Gumboro disease, also known as infectious bursal disease, is a highly contagious viral disease that affects chickens, especially broilers. The disease is caused by virus that attacks the immune system of the chickens, making them more susceptible to other infections. Handling Gumboro attack in broilers requires a comprehensive approach which involves both preventive measures and prompt treatment in case of an outbreak. In this video, we will discuss some of the ways to handle Gumboro attacks in broilers. During the rainy season, it is important to maintain the proper temperature in the brooder to prevent the chickens from getting cold, peeling up, and dying. To maintain warmth in the brooder, farmers can use curtains to prevent winds from entering and keep the room warm. However, too much heat can also increase mortality rates. Additionally, the risk of Gumboro disease increases during this time as it can weaken the bird's immunity, making them more susceptible to the disease. Therefore, farmers need to be vigilant about the temperature regulations in the brooder from day 1 to week 3, as removing warmth at an early age, 1 to 2 weeks, can expose the birds to Gumboro. Gumboro is a highly dangerous and can wipe out 90% of the flock in just 7 days, while intervention can reduce the mortality percentages during an outbreak. It is not guaranteed that treatment will prevent all deaths. Farmers should act quickly and observe their birds for signs of depression, loss of appetite, group handling, strange diarrhea, and hemorrhage on the chest and thigh muscles, as these are indications of Gumboro. Before we go any further, if you like the information I'm giving out, consider subscribing to help the channel grow, and if you are a returning subscriber, share the video and give it a thumbs up. Thank you all. Let's continue our discussion. To address Gumboro outbreaks, farmers must quickly and consider various factors such as the bird's immune system, appetite, and the spread of the disease. Inflamed bursal with hemorrhage will not produce enough antibodies, leading to the weaker immunity and the increase of risk secondary infections. To help birds with poor appetite, farmers can use syringes to provide them with water and other supplements. Additionally, isolating affected birds from healthy ones can prevent the spread of the disease. Number 1, vaccination is the most effective preventive measures against Gumboro disease. Broilers should be vaccinated against Gumboro virus at an early age. The vaccine should be administered according to the manufacturer's instructions and should be repeated as recommended. Proper timing and dosage of vaccine are critical for effective protection against Gumboro disease. Number 2, biosecurity. Good biosecurity measures are essential to prevent the spread of Gumboro disease. All equipment, vehicles, and personnel should be disinfected before entering the farm. Visitors should be restricted, and if necessary, they should wear protective clothing before entering the farm. Dead birds should be promptly removed and disposed of safely. Number 3, clean and sanitation. Proper sanitation is critical to prevent the spread of Gumboro disease. The broiler house should be kept clean and dry. The litter should be regularly changed, and the house should be disinfected before and after each batch of the birds. Water and feed containers should also be cleaned and disinfected regularly. Number 4, prompt diagnosis. Early diagnosis of Gumboro disease is critical for effective treatment. Any unusual behavior of signs of illness should be reported immediately to the farm veterinarian. The veterinarian can perform a diagnosis by taking samples of the bird's blood or bursal publications. Prompt diagnosis can help to prevent the spread of diseases to other birds. Treatment. There is no specific treatment for Gumboro disease, but supportive treatment can help to manage the symptoms. Antibiotics can be given to prevent secondary bacterial infections. Electrolytes solutions can also be administered to prevent dehydration. Sick beds should be isolated from healthy beds to prevent the spread of the disease. In conclusion, handling Gumboro attack in broiler requires a comprehensive approach that includes vaccination, good biosecurity measures, proper sanitation, prompt diagnosis, and supportive treatment. Prevention is always better than cure, and broilers should be vaccinated against Gumboro disease to prevent outbreaks. Proper sanitation and good biosecurity measures can help to prevent the spread of the disease. Early diagnosis and prompt treatment can help to manage the symptoms and to prevent the spread of the disease to other birds. Thank you for watching. Make sure you subscribe, make sure you like, and if you are already a subscriber, give this video a thumbs up, for it is helpful, and share it to other farmers so that they'll be able to learn this that you've learned. Thank you, and as always, a happy farmer. Bye bye.